Thank everyone for joining us and welcome to Open Classroom. My name is Tiffany Phillips. I'm the Director of Communications here at the Brown School. We really appreciate you taking the time on a busy day. A few housekeeping things before I hand it over. If you're joining us on Zoom, we will not be able to recognize raised hands or call on you because we're in a webinar format, but we really want you to participate and be fully engaged. So we want you to talk to each other and to our panelists in our chat. If you're joining us on YouTube, we are not able to enable the chat there or call on any of your questions, but we're really glad that you're joining us as well. Wanted to just give a shout out to a couple of upcoming things on Open Classroom. Let's see, tomorrow we're going to have artificial intelligence, implications for social equity and bias. That's going to be presented by the Brown School's Rupang On. And then on May 18th, we have what economic security looks like and how to get there, which is a special event that's organized by many organizations, including our own Center for Social Development. So with that, I'm going to hand it over to Vice Provost Mary Mckay, and she's going to introduce our speakers. Mary?
Thank you, Tiffany. Thank you for creating an amazing platform to disseminate information and connect us as a community that cares about a full range of societal challenges. Thank you very, very much. So hello, everyone. I'm Mary Mckay, and I have the privilege of serving as the Vice Provost of Interdisciplinary Initiatives here at Washington University. But my job today is to welcome you as the President of the American Academy of Social Work and Social Welfare. The Academy is truly meant to elevate leaders, academics, government officials, community leaders that have important words to say about solving significant challenges in our society. And I really want to thank my board member, colleague, Ron Manderscheid, your leadership, Ron, of bringing us folks that are leading in the policy space. Your commitment to equity in mental health is incredibly important. And you invite the best speakers to come and join us at the Academy. So I want to welcome everybody who is here on Zoom and also on YouTube, and really say thank you, Ron, to you for your leadership and for also introducing our speaker. Welcome, Gary, and he'll have some nice words to say about you as well.
Okay, yeah. Thank you very much, Dr. Mckay. We're delighted to be having this session for the American Academy of Social Work and Social Welfare. A little bit of introduction on the session. As you all know, the Surgeon General recently issued an advisory on protecting youth mental health, where he pointed out the huge crisis that we are in on child mental health in the United States. This is not something that developed simply as a result of COVID. There was a problem prior to COVID. COVID simply made that problem much worse, and the Surgeon General points that out, basically. Some people have even gone to the level of saying we have a national emergency here. It isn't just a crisis, we have a national emergency. So we want to unpack that a little bit today, talk about what that emergency is, and talk about the response that the federal government is making to this problem. I'm just absolutely delighted to have my former colleague from Samhsa, Dr. Gary Blau, join us. Gary and I worked together at Samhsa, I don't know how many years, a few years, I guess, basically, in different roles, but we were good colleagues and we worked together at that time. Dr. Blau is a licensed clinical psychologist who serves currently as the Senior Advisor for Children, Youth, and Families at the Federal Substance Abuse and Mental Health Services Administration. In the years that I knew him, he was the chief of the Child, Adolescent, and Family branch, where he provided national leadership on the development of systems of care for children in the United States. So probably anywhere you are in the US these days, you can thank Gary Blau that you have a good system of care for children. Prior to coming back to Samhsa, he was the executive director of the Hackett Center for Mental Health, the first regional center of the Meadows Mental Health Policy Institute, a role he left when he returned to Samhsa. He has many, many awards. I'll just mention a couple of them. He has received the HHS Secretary's Award for Meritorious Service, and I particularly liked the Rock Star Award presented by the Youth Move national entity, which is now named the Dr. Gary Blau Professional of the Year Award. So kudos to Gary for garnering that award. He's been acknowledged as the father of the Youth Move movement in the United States. He has many publications in the child mental health area. He received his BA degree in psychology from the University of South Florida, and he received his doctorate in psychology from Auburn University. So please join me in welcoming my good colleague, Dr. Gary Blau.
Thank you so much, Ron. It's good to see you, and I appreciate the opportunity to speak with folks today and to share some, I hope, both realities and insights into what the federal government is doing. Let me start by saying, first of all, that it is an honor to be back working at Samhsa, and I feel incredibly privileged to do this work and to serve as a senior advisor. And I think one of the significant reasons that it's made such a difference is the current Assistant Secretary, Dr. Miriam Delphin-Rittman, has 5 priorities for her leadership at Samhsa, and one of them is specifically on children and youth behavioral health. And that is so important, given everything that Ron said and that we'll go over today. And it really was the first time in my tenure with the federal government, and also 10 years in the state government with Connecticut, that which was a child welfare, mental health, substance abuse, juvenile justice agency in Connecticut, and that youth mental health issues have been that elevated as a priority in the federal government. And so it really, I think, bodes hopefully well for the future, and we'll share a little bit about that. I am going to go ahead and share my screen to get my PowerPoint started. I would continue to encourage, I won't be able to see the chat, but Dr. Manderscheid is monitoring the chat in case folks have questions. I'll try to leave a few minutes at the end for any of those kinds of questions. I think that today we're talking about this crisis in child and youth behavioral health, and what we can do about it. It's certainly from our own positions, and also supporting things that are happening that are actually some pockets of excellence across the country at the same time that we're in a substantial crisis with young people being potentially boarded in emergency rooms and having significant increases in their mental health challenges. But at this point, my main role is that I am literally on loan from my agency to Samhsa as the senior advisor. I did think it was important to share briefly about my other role, to be very clear about that. Ron mentioned the Hackett Center for Mental Health in Houston, Texas. And yes, I served as executive director for really, it was over 2+ years there, since I was there. And the Hackett Center for Mental Health really is focused on developing policies, and as we called it, putting policy into practice. We were the first regional center of the Meadows Mental Health Policy Institute, which similarly a policy institute in Texas that is really branching out across the country. When I was transitioning my role from executive director, I was given the honor of both continuing to work through the Meadows Mental Health Policy Institute as a senior fellow for children's mental health, and also received the title of emeritus executive director. So in some ways, it's my disclosure about my potential, any kind of conflicts. But I do bring all of this up because there's a lot of good work that's being done, and some of the things that I'll talk about or at least share, I learned from my last couple of years with Hackett Center and the Meadows Policy Institute. So just letting people know all of that. And I think that this was, I think, an important component, that the Hackett Center for Mental Health, and our tagline, putting policy into practice, was created by a generous donation by Jim and Maureen Hackett and their Hackett Family Foundation. They began our regional center with a $20 million gift, of which 15 is an endowment. And so I felt very lucky that as a fledgling executive director, I also had the good fortune of starting off with an endowed position and activities. If you want to learn more about the Hackett Center, you can easily find them on the web at thehackettcenter.org, or as well as the Meadows Mental Health Policy Institute, and all the great work that folks are doing there. And I am eternally grateful for that experience and for my continued learning as a result of that. With that as a backdrop, so my roles, both in terms of historical with Samhsa and then running a center, and now back as senior advisor, I hope at least puts me in a position of being helpful to our agencies and related to issues regarding youth mental health. I thought I would start off, and none of this will be overly, I think, controversial or that you don't know about. However, it is important that we do understand the prevalence rates related to this. And the reality is that these are data that we had from before the pandemic. And the first data point clearly is something that I think was always the case, which is that about 20% of children and adolescents have a diagnosable mental, emotional, or behavioral disorder at any given time. And that at least 1 in 10, or about 10% of young people have had a serious emotional disturbance, or what's described as an SED. I'm personally not a fan of that language. However, that's what's used in the federal government and in the Federal Register. And so that's what we use. The idea of having a serious emotional disturbance is that the mental health challenge impacts that young person to the point where it is impacting their ability to function either at home, in school, in community, or in their life. 10% of the nation's children is approximately 7.4 million children and youth. And that is the number that we were using for many years to say, we've got a lot of young people in our country that have mental health challenges and behavioral challenges. And unfortunately, there probably will never be enough psychologists, social workers, psychologists, psychiatrists, to serve all of those kids. And we have to address that issue of capacity and access going forward. We also knew from our friends at the CDC, they had released a report, a relatively recent report that uses data from 2013 to 2019 that talks extensively about the number of young people that are impacted by mental challenges, including almost 10% diagnosed with ADHD or anxiety problems. 1 in 5, or 20% of young people aged 12 to 17 had a major depressive episode in the past year. That actually comes from Samhsa data called the National Survey on Drug Use and Health, or NSDUH. We also know that suicide is now the second leading cause of death in young people between 10 and 34 years of age, and 7 out of 100,000 children between 10 and 19 had died by suicide in 2018 and 19. So obviously, with those significant numbers prior to the pandemic, and then also knowing that much of our concerns around social determinants of health, like poverty and access to education, geography, that causing health inequities across our country does not necessarily bode well or help us to improve on these data. The other piece that I really want to call out is really the importance of the data that have been identified that half of all mental illnesses are manifested or emerge by the time a child is 14 years old, and 75 by the time a young person turns 24. And I think that this is why we often will refer to mental illness as a pediatric illness, because so much of this occurs in childhood. So we know all of this, and these were our challenges prior to the pandemic. Now, the pandemic, as Ron described, has substantially worsened this essentially pre-existing epidemic for children, youth, and families. We know from data through the pandemic that depression and anxiety have doubled compared to pre-pandemic levels. We know that more than 200,000, it's more than 210,000 United States children have experienced the death of a primary or secondary caregiver due to COVID, with children of color being disproportionately impacted. We also know from new data from the CDC, from their ABES survey, that 1 in 3 high school students have experienced poor mental health, and nearly half felt persistently sad or hopeless during the pandemic. Some real serious concerns that we found as a result of the pandemic. And you all know this. You see it in our own kids, or in our case, in my own grandkids. I mean, our oldest grandson did first grade online. Did not go so well. It's just very, very difficult. We also know that mental health challenges are not alone, that we also have substance use challenges as well. We know that 10% of our young people have a substance abuse or substance use disorder. And most of the young people that have these challenges do not receive treatment. It's about half or so for children that have mental health concerns, but about 96% of young adults did not receive treatment that have substance use disorder. So these have combined for us to know that we are at a serious challenge across our country, and this challenge has not been lost on our a number of major media outlets. Whether and you can see some of the headlines right now. It's not unusual. I was watching a sporting event. It must have been CBS the other day, and CBS is supporting May is Mental Health Awareness Month. And so what we know is that these issues are coming into the mainstream, that we're moving beyond sort of, well, we are aware of these problems, and now we really need to know what to do about them. And so we also understand that, if you see the headlines, that this can be a life or death crisis for people. So we need to act. We need to act quickly and soon, and we're trying to do a lot of that. And many of you are our partners in this, and for that I will say very much appreciated. Ron mentioned, and as a result of what was happening, both prior to the pandemic and then during the pandemic, in late last year, in 2021, December, the United States Surgeon General issued an advisory specifically identifying the need to protect youth mental health. That advisory is a very important component to where we're doing and what we're thinking about in collaborations with the Surgeon General's office. We also know, and this is absolutely true, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association declared a national emergency in children's mental health, also in proximity to that time frame in December 21 into January of 2022. We are certainly working in partnership with these as well as many other agencies to address what has been declared as a national emergency. You can easily Google that if you're interested in finding out more in terms of what they're talking about and some of the concerns. As I had mentioned, children being boarded in the ER is certainly a concern for children's hospitals as well as others, and finding ways to treat young people in the community is so important and so needed, as well as creating an array or a continuum of care that will help all of our young people across the country. All right, so that is clearly where we're headed with all of this. The good news, basics from that I'll start to share, is that this is not lost on the administration. These issues have percolated to the highest levels. And this was the first time, at least in my recollection, and I've been in government now over 25 years plus other things, so a long time, where a sitting president really focused on the nation's mental health as part of his State of the Union speech and activities. And President Biden announced a national strategy to address, as part of his unity agenda, to address youth mental health in particular. That's my focus, although mental health more broadly. And as part of the State of the Union, created a fact sheet that was generated specifically to address some of these issues. And so this was a really important moment. And the National Mental Health Strategy really lays out a vision from the White House about transforming mental health and the concept of what can we do to transform services and systems, and how do we best assess, treat, and integrate our care. The president's vision has 3 pillars: strengthening system capacity. We'll talk a little bit more about this as we continue forward here, and I'll bring this back up again, but he calls for a national certification program for peer specialists, which also can help us with our workforce shortage and workforce crisis in many situations. As well as integration between systems and healthcare systems. Also calls for increasing connections to care by expanding access, and he specifically focused on things like schools and co-locating behavioral health and physical health providers, and then creating healthy environments where we can foster cultures of wellness and recovery. And that really does spell out in a very general way how the president and the White House team sees where we're headed with transforming mental health in America. And so we're looking at translating that ourselves at Samhsa. Now, they didn't just talk about it. The president's budget also includes a substantial increases in, I will focus on Samhsa's budget, although Samhsa's budget is not alone in these potential increases. Obviously, there are other agencies, be they HRSA is another example, the Health Services and Research Administration, or the Centers for Medicare and Medicaid Services, CMS, all looking at potential strategies to improve the way in which mental, emotional, and behavioral health is delivered across the entire lifespan. I leave this up for a minute. It's a little bit of a busy slide. However, if you take them all together, we're talking about somewhere in the neighborhood of the potential, at least, for a $3.7 billion increase in Samhsa's overall budget that focuses on really significant areas, including improvements, expansions to our block grant, the substance use prevention and treatment block grant, as well as the community mental health services block grant. They take up a lion's share, or about almost $2 billion, expanding the work that we're doing around 988 and crisis services. As many of you probably know, Samhsa is poised to begin a rollout of 988 over the summer, and really focusing on trying to create a strategy where that will be as seamless as possible as that transitions, but additional dollars there. An amazing program that started with, last time I was at Samhsa, the Certified Community Behavioral Health Clinics, or CCBHCs, adding money to those clinics, as well as a proposed expansion and creation of more community mental health centers across the country. And then we start thinking specifically about children's services and what the potential is for additional children's services. And you can see some real significant increases that are being proposed. I'm going to highlight just a few of them. $123 million increase for Project Aware that focuses on providing prevention and intervention type services in schools and coordinating with schools. Another increase of $68 million for the National Child Traumatic Stress Network. And as I have shared with many folks, that we can't ask for enough money to address child trauma and grief during this time. And I would really be remiss not to identify both the trauma impact that COVID has had, and also the bereavement component of that as well, with over 200,000 children losing a primary or other type of caregiver. We certainly must address what also is grief. And there are other forms of grief that the pandemic has had taken its toll, whether it's loss of friends and social networks, loss of activities, loss of the ability to engage with, with peers at school or graduations or a whole host of things. So all of this is really important. The one for me, and I'll skip down, mental health training and infant and early childhood mental health increases, really important stuff, is that this is the first time in a long time that systems of care, our Children's Mental Health Initiative, were to potentially receive an increase. That program is currently at $125 million. And if passed this budget, that program would go to $225 million, which sets the stage for lots of possible funding next year. And of course, all of it is predicated upon the budget passing. And we believe that that youth and mental health in particular, and certainly mental and substance use disorders in general, are receiving, for the most part, a real bipartisan support. And we want to capitalize on that because we really need to continue to move the needle. These dollars would be real money to real agencies and programs to impact real outcomes for real people. And I say that because this would make a huge difference in the way that we treat mental and substance use disorders, especially for young people with the levels of increases that we would potentially see. We also know, in terms of Samhsa's priorities, I mentioned that children in youth and behavioral health is one of the Assistant Secretary's 5 priorities, along with these others. And these are really significant because it really is honing in on what we're going to be doing at Samhsa over these next couple of years, and focusing on all of these different aspects of care, whether it's accessing suicide prevention and crisis services, preventing overdose, improving our data performance and evaluation measures, and then integrating primary and behavioral health care. Now, when you take all of these together with the reality of the data around this, the president's vision that he laid out, Samhsa's priority on youth and families, we have created, and just this last week at our Samhsa's National Children's Mental Health Awareness Day event, the Assistant Secretary sort of unveiled a little bit about our HOPE framework, that Samhsa is really seeking to provide hope across the country to America's children and families. I am honored to chair an internal work group related to children, youth, and families that is now focused on a vision statement where all children, youth, young adults, and their families thrive in their homes and communities and experience health, opportunities for success, and the ability to reach their full potential through equitable strategies that build strengths and includes their voices. And so this is really a framework that we're using. And we're taking this framework and creating the HOPE tiered system of services and supports. Some of you may be sort of familiar with pyramids and tiered systems. Well, what we're doing is trying to really make this real for Samhsa and our work. As you can see, at the very foundation of our work and our tiered system is workforce, because we cannot do this without addressing the capacity and access issues and training and literally just your sheer numbers of people that we need in the workforce. We also look at the health component, which really is about health for all. And to have health, we have to have mental, emotional, and behavioral health. So this really becomes our universal approaches to behavioral health. Our next tier talks about opportunities for at-risk youth, and these include our focus on early detection and opportunities for early detection and intervention. Others might think of it more as the selective or indicated component, and then making sure that all of our youth that may have SED or SMI, serious mental illness, or substance use disorders, SUD, can reach their full potential, which really focuses on interventions. And then if you can see, we sort of wrap around that, our little hand wrapping around the youth and family through communities and across the environments together. And that across all the tiers, we're focused on the idea of equity, diversity, and inclusion, and addressing what has historically been inequities inequities in healthcare amongst communities of color in particular, and as they have been so impacted by the pandemic. So that becomes our framework, or our little infographic, and our programs we're sort of beginning to really impact or look at how and where they fit into all of this. I won't go through this real definitively, other than to say that when we take a look at our various programs, they fit in, and they may fit in across categories, but at the same time, what we're looking at in our new funding announcements and our work going forward is to make sure that many of our activities and programs are really linked and in line with all of this, because it sort of rolls back up to the president's vision and mission. So that is an overview of where Samhsa is moving towards. Obviously, we're focused on the youth behavioral health workforce and capacity and training, ideas of integration, the role of technology and social media, creating this crisis continuum, and then we're creating various themes for us to have. Really, it's about a strategic approach to all these areas, including wellness and prevention, school-based and school-linked services, early childhood trauma and grief, measurement-based care, and then partnerships across child-serving systems, which are so critical. So that's in a nutshell, where we're headed. And what I thought I would do is to sort of, as we give a brief background into all of these issues and where Samhsa is headed, that we're also focused on actions and ways to transform our youth mental health services and systems. And I want to start off by really focusing on the idea and concept of integrated care. The New York Times actually came out with a recent article that I thought was really good on pediatric primary care and its relationship to behavioral health, and how we need to do more working together in order to address especially the more mild or moderate symptoms that might be managed in a primary care setting versus having to go to specialty care. And when I talk about integrated care, I really want to focus, I have a personal example related to this, and I say this because the first slide that you're going to see will be followed by my personal example. If you're a little squeamish, I'll give you a heads up. So this next slide actually talks about the reality that we treat the brain differently than we treat the body. We've done this for years, and our current mental health system really does separate. We have our physical health system on one side, and then the mental health system on the other side. And as you see, with this head being detached from the body, when we have a physical health challenge, we have a system set up that addresses this, that really, tries to keep people out of emergency rooms. And certainly if you have a terrible asthma attack, you're not going to call 911 or something. So, on the same time, on the mental health side, we're looking at a system where if you're in crisis, you call up somebody and they say, go to the emergency room, or, call the 911 to have a reaction. And on a personal level, a couple of years ago, this was right before we left Maryland for Houston. I woke up in the morning looking like this. And I bring this up because I was pretty scared about this, right? And that was not the way that I hope you all can tell that's not my usual look. And so the first thing that I did, so I breezed through that just as an example. So the first thing that I did was to call my primary care, my primary care doctor. And he's like, yeah, Gary, you need to come in. So I rushed in, he made a slot for me. And as I was sitting there, he was stumped. He was literally taking out books and trying to figure out, okay, what could possibly be? And then he called his friend, who was an ophthalmologist, who was a specialty care provider, and got me an appointment to see that ophthalmologist that afternoon. So I literally was able to leave my primary care doc, got an appointment with a specialty care provider, did my little bit of waiting, but got in that afternoon. And guess what? He figured it out, got me on all kinds of meds, and I did not have to go to the hospital. Now, imagine if I was that morning, woke up and I felt suicidal. well, what would we do first? Well, first of all, I would have called my provider and they would have said, well, you need to go to the hospital. So then I would have been going into an emergency department and could have been, either stuck there or wait there for hours. I can't tell you how many hours or days young people have to wait. Or if it was really bad, they might have actually said, call 911, and I would have been, visited by a law enforcement person that might have actually landed me in jail. Because of maybe of my behavior, I was acting out, I wasn't in contact with reality, and literally that's the way it was. Bypass all this idea of primary care, and that's our fragmented system. And so what we really need to do, and the goal is that the best mental health care system is like the best healthcare system, where we integrate our mind and our bodies, so that we do the same kind of a thing. Well, if I call somebody, maybe my primary care can see me, or they have somebody there that could see me, that could address this kind of a crisis. There are models out there. Many of you may be quite aware of them. In Texas, we were focused a lot on what's called the collaborative care model. And that approach specifically looks at both housing and coordinating and creating case managers between primary care and the ability to get behavioral health care services. And, when 75% of our parents and caregivers take our children to the pediatrician or pediatric primary care practice first when they're concerned about their mental health. So if we're already doing that, which we are, then how do we bolster and support our pediatric primary care providers? How do we outstation more social workers or psychologists and marriage and family, whoever that we can, into these settings to be able to address these issues, whether it's collaborative care, primary care, and behavioral health integration models. What we're learning from studies is that it works. And now we're bringing those into the youth and the child and youth area as well, because we're also learning, and there's a wonderful study that my former agency is doing in Dallas area around integrated primary care for young people through a health system that's there. And so we really need to focus a lot more on bridging this gap and doing much more in the way of integration. The second area that I will focus on in terms of transforming has to do with school-based, and what we've likened to call school-linked services. Now, the other place that people go, other than their pediatric primary care when they're worried about their kids, is that they talk to their school, whether it's a teacher or guidance counselor, or if they have a school social worker or school psychologist. But that is absolutely another area that we're wanting to connect with, like Project Aware, like HRSA's school-based health center programs. And again, some of our schools, especially those in rural communities, don't have the capacity to address these issues, which is why we not only talk school-based, which is great if possible, we also need to link services to the schools with folks from the community. And that also may help with billing or access and things. And so we're looking at these strategies. We're hoping, obviously, with the potential budget increases in Project Aware, along with some really, I think, important lessons learned and examples, and highlighting examples about how a multi-tiered system of supports can address the mental health needs of students and ensure that schools are both safe and secure from emotional standpoint as well as others, because that's where our kids are learning. There is a really cool program in Texas called the Texas Telehealth for children and families. It's T-Chat. I don't have the acronym handy in my brain, but you can actually Google TCHATT. It is a telehealth program for schools, and that program also allows for assessment and brief treatment in terms of young people that with parental permission, you can access this telehealth service that's through the medical schools in Texas to get support for an assessment or an intervention. And I think it's a real great opportunity for us to do more. And in other states, and obviously in Texas, I always like to say, if we can do it in Texas, it can be done, and we can do it across the country. Another area that we're really focused on and highlighting is the importance of creating an overall crisis continuum. I did mention the 988 piece before, and how we're seeking to ensure that if somebody calls that number, that we are really focused on that there is a place to call or someone to call, someone to respond, and that may be, on the phone, it could be through telehealth, or it could be a mobile response, as well as a safe place to be, hopefully in homes and in families, but also making sure that the young person is actually safe in whatever crisis that's occurring. We also really are focused on expanding the ability for communities and for states to activate a mobile response and a stabilization team that are focused on children and youth, so that the right services are provided by the right people with the right expertise. So one of the things that we're trying to highlight, and working with our colleagues across the country, particularly those in positions of leadership in children's mental health, is that the new 988 system really needs to include a specialized focus on children, youth, and families, because the crisis for children and youth are often quite different and need a differential response than that of adults. And so really highlighting that, we have technical assistance to do that, and Samhsa is actually poised to issue a briefing paper in the not too distant future related specifically to this crisis continuum for children and youth. So please stay tuned for that, and we're looking forward to being able to share some more details about your best practices in this realm. So these are areas that we're really highly focused on. Another area that I think is really critical to this piece, when we start to think about how do we expand access to services, how do we ensure that we have capacity to meet the needs of so many young people, is through youth and family peer support. Because youth and family peer support can really expand capacity and extend the access, and the data that have been generated over the last number of years, as this has become more and more embedded in our service system, and financing options have become more available across the country in various states in various forms. But if you happen to live in a state, for example, where Medicaid supports youth and family peer services, then good. If not, there are strategies. Actually in 2013, Samhsa teamed up with CMS to issue an informational bulletin specifically about coverage of benefits for children and youth that have serious emotional disturbances and serious mental illness. And one of the things that was said, and I'm happy to share that with folks, or you can Google 2013 coverage for behavioral health services, Samhsa CMS informational bulletin, and it's 9 pages, and it really does list 9 different approaches that can be taken that CMS will approve if in fact that the state has the ability, either through a plan amendment or a waiver process, to implement. And one of them is youth and family peer support. Just quickly, others include respite care, wraparound or intensive care coordination, or also the use of a flex fund approach that's tied to a treatment plan. All of these kinds of things can be included in a state plan for reimbursement under Medicaid. And one of the things that we're focusing on now, amongst many of those, as we're looking to expand systems of care and better at coordinating, is really to work with young people and family members who have lived experience. And I can't tell you on a personal level how important it has been for me to work closely with youth and family members with lived experience to gain their perspective, and also as they have been through the system, knowing the pitfalls and the challenges with navigating our system, that they can often be tremendously helpful to others in a sort of pay it back or pay it forward sort of a way. And we need to continue to work on professionalizing our youth and family peer support providers. And that is one of the highlights of the President's State of the Union fact sheet, where it talks specifically about a national peer certification approach. And we, in the world of children and youth, want to make sure that that's not just an adult situation, but that extends to youth and family peers as well. And we know that by doing all of this, that lives are improved, outcomes are improved when we engage and have youth and families involved in both the process of treatment of individuals as well as the process of improving systems and looking at reform efforts. So we really are, I think, again, focused a lot on engaging with young people and our families. It's part of our vision to ensure that their voices are we're partners in this process, and that together we are going to continue to make progress on these issues. And I would love to see us finding ways to expand the ability for communities and states across the country to have youth and peer support and specific programs that are funded and paid for, whether it's through foundation dollars to get started, or block grant dollars, or hopefully service dollars eventually that will sustain this kind of work. That's another area. We also, I think, have to be on the lookout for new technologies. And I was looking at the May 4th, may the 4th be with you and all. And what we're looking at right now are some very significant, I think, I'm hopeful, improvements related to technological interventions for children, youth, and families. And now we're all familiar that there are, there's an app for that. Well, we have lots of apps, and we're not so sure yet where they're all working or how they're not working, but there's a number of companies that are coming into the United States where whether it's to provide specific evidence-based practices through them, whether it's to do support systems and engaging in almost like a mental health or a substance use support technology. All of these things are coming on the horizon, and we're going to need to do a better job of researching this, of determining what is working, what is not working. And we're also needing to understand how the new technology may be both positively and also potentially negatively impacting our young people across the country. And as part of that, I just thought that I would share, obviously, we talked about the priorities under the Assistant Secretary. One of the things that I give the Samhsa leadership while I was gone real credit for was that they took the majority, almost all of the discretionary programs for children and youth in the Center for Mental Health Services and housed them all under one division. And that division now goes really from mental health, wellness, and prevention activities through early intervention and then through treatment. And that to me was a substantial achievement to do all of that, so that we literally have a continuum of care that is under one division now. We have created this new, or resurrected, I should say, this internal cross-cutting work group on youth behavioral health, where folks across Samhsa can not only work together, but look at ways to collaborate, look at ways to support each other, sharing both resources and networking abilities with grantees and the like, so that we get the latest and greatest information out, through whether it's our technical assistance activities or best practice approaches that the field continues to have those, and we're going to be continuing to do that kind of work. The other thing in terms of, I mentioned the technology. Well, one of the things that has come up, and it was also highlighted in the President's State of the Union fact sheet, is that the social media, and I think there's been a number also of newspaper articles. The Congress called some of the social media firms, including Facebook and Instagram, to Congress to testify about their knowledge of how social media and the algorithms that are being used, and trying to focus in on keeping people online and what that could mean, whether it's the whole concept of using social media and how that can be negative as well, and what do we need to do to address it. And the president's State of the Union called for a new center of excellence on social media for youth mental health. So stay tuned, because that is yet another area not only are we focusing on, but want to make sure that Samhsa is also trying to work to provide the latest and greatest information about best practices, and also working closely with our colleagues at places like the National Institute of Mental Health and the Centers for Disease Control, so that we can do a better job of researching these issues and addressing them. And also, what do we need to do with our social media companies in essence, in order to make this better and less of a challenge for our young people. And, you know, whether it's your own kids or as my grandkids are getting older and using social media or using technology in various ways, I want them to be as safe as possible. And I also know that it really can be helpful, because whether it's maintaining connections with your child through, an app or a phone or a watch, or understanding where they are, or even our 8-year-old grandson has a special watch. It also tracks his steps. He loves it because it gives him feedback about his mental wellness on the day and whether his physical exercises enough. And those are things that we want to really use, and at the same time understanding that we may be challenged if we are not focused on the potential for negative impacts as well. So I'm excited to be back at Samhsa for these opportunities to sort of reinvigorate and renew this work, these collaborations and partnerships internally and externally. And so I'll leave you before we turn over to questions, that all of you are in the role of making a difference. And it's important that as we share with others and students that making the difference you make really does make a difference in people's lives. And it doesn't have to be major changes. Even small and incremental steps make a difference across the country or in a particular person's life. We've seen, as folks mentioned before, as being identified as the father of Youth Move, that young people across the country can make an amazing difference. They can get into our field. They can use their lived experience to give back, to help others, and I have certainly seen and witnessed the positive impact of that. And that's what we want to continue to do. So if you're all interested in continuing to learn more about some of the work that I'm up to, please feel free to follow me on Twitter. I think that probably need to update my background, but I think that you can do that. Or please, I say friend me on LinkedIn. That's certainly one of the things, but doing that. And ultimately, I really just want to remind people that Samhsa is continuing to focus its mission on, to reduce the impact of substance abuse and mental illness on America's communities. I'm really proud of that fact. At the same time, I think that we are particularly challenged right now in doing a lot of this work, as many of you know. I'm going to stop sharing my screen, and given these realities, given all of what we're trying to accomplish, we need partners. We need help in doing this. We need our universities to continue to churn out, really qualified people in the workforce, training them well. We need to make sure that we are focused on evidence-based and measurement-based care type of interventions, so that when folks do get into the workforce, they know how to deliver services and how to determine whether things are working really well. And so I think together we can continue to make a major difference in people's lives. So that's where we stand, and I'm going to turn it back over to Ron for the last minutes to have a conversation or answer some questions. Thank you very much.
So thank you very much, Gary. Wonderful presentation, wonderful challenge to us to help move this field ahead. We do have some questions, and I think they're very important. So the first one, One of the issues for child mental health is having an inadequate number of providers. The question was, how does the Biden plan address the particular issue of increasing the number of mental health providers?
Well, I'll start by essentially saying that the Biden plan has put money into the idea of expanding capacity, of working with universities to do this, of addressing the, say, loans and other issues that people may have to make it more feasible, more palatable to go into a behavioral health field. And then we're going to have to continue to focus on ways to improve the salary structures for folks. When a beginning social worker is paid at a level where they can't below subsistence level, then we got real challenges. So the president has proposed a number of programs expansions, especially at HRSA. In order to do this, we are also looking at strategies to reach into not just colleges or really community colleges and even into high schools, to promote the idea that people can both go into the field, use their lived experience in the field, and to continue to focus. This is not going to be a problem that is going to get solved right away. The pipeline is too long for us to just sort of turn on the dime and say, okay, well, here's more psychiatrists or doctors or pediatricians or whatever that are doing this. So it's going to take time. It's going to take working with our guilds. We're looking at expanding our minority fellowship program, where we're to try to bring more people of color into our field. So it's really a lot of those different kinds of fronts. I think that one of the best ways that we can really move the needle quicker is to move on youth and family peer support. I think that would be really important going forward, and whether it's through additional professionalization of that field or just ensuring that there are financial incentives and grant monies and hopefully financial reimbursement mechanisms through insurance companies, et cetera, whether it's Medicaid or private insurance and commercial insurance products. So all of those things have to be addressed together if we're going to make progress. What we don't want to have happen is this same concern, 5 years from now, to have the same conversation again, which is always our real, concern, that we've got to put these things into place. And let's do these things now, even though they may take a while for it to get the uptake necessary to continue to make a difference. So anyway, those are things that I think we can do immediately.
Excellent, excellent. Again, another question. How can mental health agencies support the development of better mental health in schools?
So I think that there's a tremendous opportunities for linkages between community agencies and schools. I think the first thing is that to have conversations with school leadership. The school has to, want the support. They have to need the support, and it's to find out really what are their gaps, what can be done to coordinate together to do this. So there may be some principals that have more needs in certain areas, and so it's about having those conversations and developing a strategic plan in order to meet those needs. It could amount to training of school personnel and identification of issues. It could amount to training school clinical staff in particular evidence-based practices. At the Hackett Center, we did through the Trauma and Grief Center. That was at the Hackett Center. The Trauma and Grief Center would train social work staff as well in the schools as well as in the communities on delivering evidence-based trauma treatment or evidence-based grief therapies. So there could be a role for education, for training, for support in clinical aspects, or provision of services themselves, so that the school could link this and say, hey, we're working closely with a provider. Of course, all of this is with parental approval and permission, because that is a critical part of that. And with that support and permission, could reach out and help to connect the dots to get an assessment or specific treatment in a community agency. I think there's a lot of ways to do that. Samhsa Systems of Care Grant is an example of how to use grant monies to support wrapping all of that around youth and family. And so I think that really the sky's the limit. Prevention programs can be delivered in schools all the way through assessment and treatment.
Yeah.
We have
Excellent.
time for one more question.
One more question. So I guess the preeminent question, how can a person become involved in the initiatives you've been talking about?
Well, many of the initiatives that we're talking about are cascading into, local communities. So it depends on where you live, honestly. Most, all of your states have a substance use prevention and treatment block grant, along with the mental health block grant. Those dollars flow out to provider networks. I certainly am encouraging people to support the plan, the president's plan and budget, along with Samhsa's framework and how we want to take these steps forward. You can get involved, whether it's providing services or providing support to community agencies. You can, literally, whether it's being on boards or helping with training kinds of things. Really, the sky's the limit. Now, we've moved and trying to invest in our local community to coordinate around schools. It's really about investing in an area that really matters to you. Is it the crisis continuum? Is it a school? Is it related to agency improvement or best practices, evidence-based care, all of those things that we can do together. So, and if anybody wants to, I am fairly easy to reach. I'll put my in.
So I assume you're putting your contact information into the chat here.
That's exactly right.
And while you do that, let me thank you. Wonderful presentation. We all give you a round of applause virtually here. And we all have marching orders now to move the agenda on child mental health, which it's so obvious that this is needed. It's so obvious that there are good programs out there. And it's so obvious we need to support President Biden and the Biden plan moving forward here. So Gary, thank you again ever so much. We'll look forward to hearing updates from you in the future as we continue to work on this problem. So thank you again ever so much.
Thank you. You all be well. Reach out if you need anything.
Okay, take care.
Bye-bye.
Bye-bye. Thanks, everyone.